Invisalign is not for everybody because you have to be very responsible. You have to wear the device. My name is Dr. Alex Chung. I graduated from USC Dental School and I went to USC Prosthodontic Residency. We do specialize in dental implant, reconstruction, and mostly cosmetic. In our office, not only we do implants, veneers, but majority of the patient who requires implants also needs Invisalign. Invisalign is not for everybody because you have to be very responsible. You have to wear the device. So before we're doing Invisalign, we take the patient's scan by using this scanner, intraoral scanner to device to see how the teeth are, how the alignment should be done. So this device allows us to see and teach the patient what is required. And with this device, we could accelerate the procedure a lot faster than old traditional way of making impressions, sending it to the lab. It should help out the patient quicker and more precise. The brand is called Invisalign iTero. And this device allows us to scan, but they're very, very detailed. It shows where the filling is, how the teeth are actually looks like, and where the cavity is. It tells you everything. Little cracks. So by using this, I could actually discuss the patient, every little details of it. When we have a new patient, not only for the Invisalign, but also for general patients who needs a lot of work and they don't understand what we are going to do, what the color of the teeth actually looks like it too. So if they don't like that, we just say, you know what, let's don't look at the color. So now we could talk to the patient without seeing each tooth as a color tooth. From here, if we were to do a veneer or anything, it'll be something like very similar tone of the color. We could do that. But if you want to see more detail, you could see the line pattern of the teeth color. And some patients don't like these colors. And that's where this device, iTero, will tell you, there's a problem, there's this, how much the gum is receded. All the details are shown on this little scanner. Basically what they do is Invisalign allows to make series of trays. And this tray allows the tooth to move little by little every little session. So gradually, the teeth are in a motion by one tray, next tray, next tray. So by sequential of series, the teeth will go from one area to another area. And they are all done by computer, generating how the teeth should be moved into safe spot. Invisalign can improve the oral hygiene, but at the same time, if the patient doesn't do anything, patient could have a very severe sensitivity, or number two, can have a lot of cavities to it. Because tooth is protected by this aligner, and if they don't clean it properly, they always tend to have more cavities than if they didn't. So once you start the Invisalign, you and the doctor has to maintain good relation. So number one, oral hygiene has to be improved, your maintenance has to be improved, and your requirement has to be maintained. Otherwise, Invisalign doesn't work as well. I think the better side, there is no specific side effect to the Invisalign because if the Invisalign doesn't work, we could always take it out. But it doesn't give enough force to damage the tooth, whereas traditional wire, if it's not done properly by an orthodontist, sometimes the force will harm the tooth more than Invisalign can. If the patient is not qualified, meaning responsible, I strongly cannot recommend Invisalign. However, if you're a responsible person, meaning not a teenager, a little bit older, who has a lifestyle, then I would strongly recommend Invisalign, because Invisalign, you could hide everything. And sometimes if you need to talk a lot, then sometimes they can take it out to make it free speech. So Invisalign is much easier way of treating your teeth than traditional braces. As a prosthodontist, I think my greatest strength is be able to treat the patients who has a large scope of dental problem. Not one tooth, but larger scope. We do specializing dentures, and we do a lot of implant reconstructions. So if we were to do something, we're not dealing with one tooth, but many teeth. And lastly, if you already have an implant where you're already having a problem, then I could fix anything that deals with dental implants. What basic treatment is doing with dental implants, veneers, crowns, and complete dentures. However, my subspecialty allows me to do scoping of very, very detailed work. If you want to do cosmetic denture, that's what we do. If you have an implant where you're having a problem, I could fix everything. I have been doing implants for last 20 years. I have dealt with a lot of other countries' implants, European implants, Asian implants. People who comes from China had a lot of problem with Chinese implants. I was able to fix all that. Sometimes we have to take it out to replace it, but because of my specialty of being a prosthodontist, I'm able to fix majority of all implants.